So we're going to go ahead and start. Welcome to today's webinar, everyone. Again, I'm Donna Rice, the Chief Operating Officer for Diabetes Sisters. Today, our webinar is Tech Savvy Diabetes, Unlocking the Power of Diabetes Management. Our speaker is Becky Sulik. She's a registered dietitian, a certified diabetes care and education specialist, and a licensed dietitian. She's the Director of Education at the Rocky Mountain Diabetes Center in Idaho Falls, Idaho, and she brings over 25 years experience as a registered dietitian and a diabetes care and education specialist. As someone diagnosed with type 1 in her teenage years, she's passionate about using her expertise to make diabetes care more accessible and manageable. Becky is particularly known for her work with diabetes technology, such as insulin pumps, continuous glucose monitors, and automated insulin delivery systems. She's been instrumental in various research initiatives and continues to work on advancing diabetes care through both clinical work and volunteer leadership roles in professional organizations. Today, Becky will be sharing insights into continuous glucose monitoring, insulin delivery options, connected insulin systems, and diabetes management apps. We encourage you to submit your questions again through the Q&A, and we'll make sure that we save time at the end for Becky to address them. So please help me in welcoming Becky Sulik.
Great. Thank you, everybody. I'm really excited to be here with you today, as I feel like in addition to being a healthcare worker, I'm just one of you. I have diabetes and have had so for next month. It will be 40 years. And so I've seen a lot of changes in technology. All right, I'm going to share my screen here so that you can see the slides. So today we could probably spend hours talking about diabetes technology. But since we have a limited amount of time today, I'm going to tell you to buckle your seatbelts, and we're going to take a little tour through the options and what technology is offering right now, and hoping to answer some of your questions as part of my presentation, but also then get some of your questions. That will also help us to better understand what your needs are as well. So, all right. So, why do we have technology? There's a lot of good things that come from technology. I think for me, it's helped my blood sugars to more easily keep my blood sugars in the goal range that I have more often. It's gotten easier to do that with the help of technology. It's not perfect, of course. It may allow the provider. So when you see your physician or your diabetes care and education specialist, I feel like people wearing technology to help, it's easier for me to help them. Safety, of course, for many people, it can warn of reduced chances of low blood sugar as well as high blood sugar. And it could reduce the diabetes management burden. And I saw in the chat that for some of you that was true. And then some of you, maybe the technology is adding a little bit more stress. So it's something that the technology we hope to, better address as we develop new technology. All right. So, oops, there we go. So we're going to cover these 4 areas very briefly. We have monitoring, we have insulin delivery, we have apps, and then we have integrated systems, which combine some of these things to help us. So again, we're going to take a quick look at these. So the first thing is monitoring. And if you've had diabetes a while, you've probably seen the evolution of monitoring. Of course, we've had finger stick blood glucose meters for quite a while. There are many brands out on the market right now. And while we used to feel like some brands were maybe higher quality than others, that technology has really improved at all levels. And so even the store-branded models are working well. And some of these are connected to smartphone apps too, so you can manage your blood sugar and see your data in a different way than you used to be able to scroll through a meter memory. And then, of course, we have CGMs now, and they monitor interstitial blood glucose, not actual capillary blood glucose. But really, I think the biggest thing that this has added to for me and for many of my patients are the trends, learning about what the trends can tell us and looking at data retrospectively as well. We have, of course, real-time CGMs and flash CGMs. You'll see that we're moving towards more real-time, where it's just showing up on a device so we can see it. We don't have to scan it. The types of CGMs we currently have, I have little photos down here of them. Little pictures of the different ones, but we have the Dexcom G6 and G7. And then we have the newly, available Stelo, which is for non-prescription, doesn't give alerts, but that is available now, and it's patterned after it looks like the Dexcom G7. We have the Freestyle Libre 14-day. It is still available, but I don't have very many people still using that one. Libre 2, Libre 3. And we have the Medtronic Guardian 3 and 4 sensor available. And then we have the Eversense sensor, and this is the implantable sensor. And just fun fact, the 360-day wear Eversense was just approved yesterday. So that's now available. If you haven't heard that much about Eversense, we can, if we have time, we can share a little bit about that, but it is a kind of a unique sensor. All right, so let's talk about monitoring pros and cons, particularly with CGM, because there are a lot of pros and we tend to really herald those, but what about the cons? What about the challenges? And some of you mentioned in your chat or in your Q&A just a little bit about that. So again, as I stated, we like the data, lots of learning, right? But I've had some people be overwhelmed by that amount of data too, if they're not used to seeing that. So I feel like for many of us, we have improved decision-making. That's possible pro. Fewer finger sticks, I think, is a huge pro. If anybody hated finger sticks more than me, I'd be hard to find them. I just really enjoy not having to poke my finger as much. I like the alerts to warn of hyperglycemia, but sometimes the alerts have fatigue, which is one of the cons. The ability to share data with a support person or with your healthcare provider is also very nice, not just for the person with diabetes, but for us as healthcare providers. And then again, I believe that having that data allows me as a healthcare provider to help improve the recommendations and things that I can do for my patients that I'm in charge of. Some people, as a con, some people just like wearing the device on the skin. It just bothers them to have something stuck on their skin. Alert fatigue is definitely a problem, and skin irritation. I have a growing number of people that have a challenge with that. They have an irritation from the skin and adhesive, and it seems like when the companies change their adhesive to try to make it stick better, we see more skin irritation. And then to change the adhesive so we don't provide skin irritation sometimes means it's not as good at sticking to our skin. So coverage is getting better for these CGM products, but cost is still an issue for many. Some people still have to pay a significant amount to have that. And so I still see that as a barrier or a con. And then again, that data overload. I call it the deer in the headlights for me. When I first saw this data, it was a little bit overwhelming. I want to point out too that many of these cons can be addressed with the help of a diabetes care and education specialist or your providers. Because I have found that we can find there are some solutions to these issues. So if you do have cons and you feel like you're overwhelmed, that would be my advice, is to seek some help about that, because there are many knowledgeable people that can. Big question about accuracy. And I even saw some Q&A answers in there talking about this, but I think this is one of the #1 questions I always get. And I think the questions I had when they first came out, what is accurate? Interestingly, because our clinic is involved in a lot of research trials, we are involved in a lot of the accuracy trials for both blood glucose meters and CGM devices. And so I've learned a lot about what counts as accurate. And so many of you may know that the most accurate measure of any blood glucose measuring device is compared to the lab value, your plasma glucose. That would be your true value. And since we don't carry a lab around with us, we don't really know. But in studies, study subjects are wearing often multiple devices, and they're in clinic sessions, they're having their blood drawn out of an IV every 10 to 15 minutes, just depending on what they're measuring. And each of those samples is run in a lab machine right there on multiple people. And then, of course, this is compared. This is what the data is compared to. So just to explain that a little bit different, what is the rule? What's allowed? So if your blood sugars are below 70 points, 70 milligrams per deciliter, then 95 of those samples, 95% of them have to be within plus or minus 15 points. So if your blood sugar was 70, that means that in those studies, those should range from 55 to 85, the readings that they're getting. Now, if you're above 100, then more than 95% of those values that they're getting in that study have to be within plus or minus 15%, not points, but percent. And so this is interesting. The higher your blood sugar gets, that widens the range of what's considered accurate. And so, for example, at 100, in the study, if someone draws a plasma glucose of 100, or that's their true value, then any monitor, any blood glucose meter or CGM that's reading between 85 and 115 is considered accurate. But when you go to 300, that range, that 15% would say anything from 255 to 345. Now, many of you have been in this situation. You have no lab at home, so you don't know what your true value is, but maybe your blood glucose meter is saying 320 and your finger stick is saying, your CGM is saying 270, and you see that difference and that worries you, right? But they would both be considered accurate in a clinical trial. So that's just something important to remember. And interestingly, having been in some of these trials, sometimes the sensor has been closer to the true value than the finger stick, because in many of these trials, we're doing both. And so basically the answer I want to give is to allay fears. They aren't always perfect, but neither are blood glucose meters. There's errors with those too. And so we still have to use our judgment, but the sensors available now are quite a bit more accurate than the meters we had 15 years ago. So that's good news, right? Okay, let's switch a little bit to insulin delivery. Insulin delivery, we have some different devices now. This has come a long way since injections. I remember giving injections with syringes, and then we came with the first insulin pens. So we still have insulin pens. We have some really nice ones that are available now that I'm going to highlight just a little bit. We have some connected insulin pens that can monitor your dose and connect to a smartphone app, and so that it can calculate your dose for you in some ways. Your provider can help set that up where you can put in your carb ratio and so forth. And then all you have to do is, it's almost like in a way, similar to how pumps calculate. There's the InPen from Medtronic. There's the Tempo Lilly makes, and that one is a smart button that you put on a special pen, and then it connects with an app. And then we have Bigfoot Unity. And again, they can keep track of your doses. And that's nice for us as your provider's looking at that, because we can see how much you took, because it's hard to remember all that stuff, and it is a pain in the butt sometimes to keep a logbook, right? Have any of you loved to keep a logbook? I think it's nice because it logs it for you. It has reminders, so if you're struggling to remember to take your insulin, you can get those. And then some of them will integrate with the CGM. So for example, some of my patients have the InPen or the Tempo. They can link that app to their Dexcom, let's say, and they can see their data on that app as well. We have some insulin delivery patches. These are not as sophisticated as these insulin pens or insulin pumps that we're going to talk about, but these are delivery devices that reduce injections. And so 2 are on the market right now. The C-Cure from Simplicity. It's basically a little device that you fill with insulin and you insert in your skin. It's like you wear it on your skin, and you just give a little pulse on a button when you want to give a dose of insulin. And so it's a bolus only pump. And then there's the Vigo. It's been around a little bit longer. And this is one that I think we use more often with type 2 diabetes, but you pick the certain one and you fill it with insulin, with rapid insulin, and it gives you a preset basal amount. So you can't vary it like you can with a traditional pump, but it does give a little basal amount, and then you pulse the little button each time you want to give, and usually each pulse is a couple units, for example, and there's different models of that. These definitely can reduce insulin injections, which is nice, and they're used with rapid insulin, and they're usually changed every 1 to 3 days, just depending on the insulin and stuff. And the insulin delivery is a push of a button again, or a little kind of sliding a little slide rather than having to give a shot each time. Of course, insulin pumps, they're one of my favorite things. I know that they're not perfect, but I love having been involved in trials. And of course, I've loved seeing the evolution of insulin pumps, and many of you maybe have seen that as well. So We have the 780G from Medtronic. We have Tandem has 2 pumps, T-Slim X2 and Mobi. We have the Omnipod Dash from Insulet. Now the Dash is not an automated system, but it is still available as a standard insulin pump. And then Omnipod 5. And then we have the iLet from Beta Bionics. I want to point out that the Omnipod Dash and Omnipod 5 are patch pumps, so you don't have any tubing with those. So those are unique. Of course, insulin pumps in general have programmable basal rate. So if you remember taking a long-acting insulin like Lantus or Tresiba, that's one basal rate the whole day. Whereas a pump, you can say, I need more basal at night, less during the day. You have bolus calculators. Even on the older traditional pumps, you can store your ratios. Your healthcare provider can help you, and you can put your carbs in, and it gives you more specific doses than maybe what our rounding would do with an injection. And of course, I have to really point out that AID options. Now, these pumps without sensors can just still be used, but really most people, if you have coverage for an insulin pump, you very likely have coverage for an AID system. And this is where they have some brains where they talk to the sensor and they have an algorithm, and basically it adjusts based on your blood sugar. And we're just really seeing a lot of good improvements there. What about apps? Just plain smartphone apps and things like that. Just as a brief coverage of that. They, as I mentioned, they can display your blood sugar data. Even some of your meters can connect, and some of them can share with your healthcare provider. And I've put a list here of several different kinds of apps that are available now. We have pump apps as well. They can display your pump data on a smartphone, in many cases share with your healthcare provider. And I've listed some of those. And some of these, you can even dose your insulin from the phone. So for example, Tandem products, if you have a compatible smartphone, you can actually give a bolus of insulin on your phone, which is nice for some people. There's diabetes management apps, and these are apps that just can help you with record keeping. So if you like to, if you dislike keeping a paper logbook, these can be really, really helpful. I liked Happy Bob when I was checking this out. This gamifies the logging a little bit, which is kind of fun. But these are all pretty good apps, and there's more all the time coming out. And some food-related apps, they can be helpful to look up carbohydrate counting or carbohydrate estimation. I personally love Calorie King because I can look up things. When I was at the fair, I could look up funnel cake, right? And kind of get an idea of what funnel cake might be. And then here's some of the integrated systems. We have InPen from Medtronic, again, integrated with smartphone CGM. Bigfoot Unity is integrated with the Libre 2. And our new Tempo that I mentioned, that one can display your Dexcom G6 or G7 data. And of course, I mentioned the automated insulin delivery pumps already, but these are the ones that we have right now that I mentioned, just pictures of those. And this is a summary of those. Again, Medtronic, Tandem T-Slim, and Tandem Mobi. If you haven't heard about the Mobi, it's a little tiny pump. It's a little pump that holds 200 units, and although it's not tubeless, it has a really tiny infusion set, and everything is run on a smartphone. And then Omnipod 5 is the true tubeless pump that's automated, works with Dexcom G6 and G7. And probably the latest one of these would be the Beta Bionics iLet. And this is one that you basically enter your weight, your provider has that, and it calculates your initial settings. And then you just do meal announcements. You just announce on the pump, and if you're having like a regular lunch or a bigger than lunch or a smaller than lunch, and then it learns. It has automated, artificial intelligence that is learning somewhat about your dosing. The ADA standards of care are really encouraging that, and these standards of care are not meant for us as users, as people with diabetes, that we have to memorize these, but I think it's good to know that they're really promoting the use of technology, and that these are going to our insurers, our, insurance companies and things like that. And so these standards are basically saying how valuable these are and that they should be offered to people with diabetes. So just a little bit about choosing technology. Cost, compare your costs. Sometimes your coverage is covered through your medical side or DME versus pharmacy. And there's an initial cost and sometimes an ongoing cost. So that's how you might compare technologies. What requirements do they have? Some of them require a smartphone, others do not. And then some may need the internet if you want full functionality of those. dexterity. Do you have any problems with dexterity? So when you're choosing devices, test strip size, for example, lancet device, lancet removal, CGM insertion, how is it inserted? How hard is it to do that? Where do you have to put it? Same with the pump with infusion sets. Am I able to handle that? Am I able to utilize the pump if I have any dexterity issues? And there are many things we can do to help that. Vision and appearance, if you're someone that has some visual impairment, are you able to see it? Are you able to read the screen and use it? They do make talking blood glucose meters. Same thing with the pumps and smartphones. Can you see and be able to access what you need? And there are certain pumps that have some options of giving a bolus with a button if you can't see the screen and enter data that way. And then support considerations. Do you want to be able to share your CGM data, for example, with support person? Do we need assistance with management tasks associated with the device, and what, can a significant other or a family member or friend help you with that? And then the prescriber, can they see your data, and can that help them as well? So those are just some considerations to think of. Now, we do have some resources available, and I do have them on the slides, but we are going to provide a handout for you to so that you will have access to these different resources, and some of them help you compare, for example, insulin pump systems and troubleshoot sensors falling off and things like that. But with that, I'm going to go ahead and end my presentation, and I am really excited to hear your feedback and answer some questions that you might have.
Thank you. Thank you, Becky. That was a great overview, and I know our members probably have quite a few questions. So at this time, I just would like to say that Becky's prepared 2 handouts. One will be on the resources, and the other one is really kind of like that little assessment that she went through. So if you're thinking in terms of kind of a new technology, or maybe it's for your mother, because I did see a lot of comments saying that they're working with their mother who's 80 and all that. There is a little a technology assessment that can, I think, help you and guide you as you're thinking through other treatment options. So let's go ahead and open it up for questions. So I'm going to give you a few minutes to go ahead and put questions in the queue. And I just kind of have one question here, and it's from Belinda, and it says, what are the main factors to consider when choosing between different types of continuous glucose monitors?
That's a very good question. And I think that sometimes for many of us, it might be coverage. So as an example, I have a plan that covers one of the sensors as a durable medical and one as a pharmacy benefit. So one is less money for me to buy. So if cost is an issue, that might be different. Do you want it? How long will it last? How long will, do you have to have a smartphone, or can you use a reader? Some of them have a reader and some of them use a smartphone. So things like that would be useful. I think they're all fairly accurate. And so I think in terms of what one is better that way, I think they're all pretty neck and neck that way. If you are wearing a pump, that might also determine your decision, as if what one will work with my pump and things like that.
Very good. Okay, we have a question come in from Deborah, and it says, we're having trouble with the Follow app. Any way to troubleshoot, or maybe we should delete it and reinstall it?
The Follow app could be there. Some of the issues that we have, that's the first place I'd start, is restart the phone that the Follow app is on, and possibly the one you're following as well, because the obviously the person that you're following has to have their smartphone and have it working on their phone. So if there's any connectivity issues between the phone, the user's phone in the cloud, and then the follower getting that data. If that doesn't work, then I would just call the Dexcom helpline, which is in the user's app and I think in the Follow, but you can call them and they'll help you troubleshoot it. And they can also advise you on if there's a certain smartphone compatibility. Some phones are older and aren't as compatible or aren't as easy to use. And so sometimes the issue is there as well.
Good. Okay, another question came in, anonymous. It says, thank you, very helpful. Could you talk more on the clinical trial and acceptable variance on BGMs and CGMs? Is there a source for those clinical trials?
Well, interestingly, when you get a sensor, for example, and you have that big old bundle of paper that's inside, you'll have it's called the package insert, but it often will have summary of the clinical trials and things like that. Also, on the websites of the different sensor products, you can request those. I think just having conducted them, in some cases, I was in some of them, and I remember in one case, for example, wearing 3 different sensors, and at the same time, right, I had 3 different ones on different parts of my body, and then I was several days hooked up to an IV and was here for 12 hours, and we were just drawing that blood. And in some cases, we would manipulate the blood sugars so that we would have to agree to make ourselves go high and then go low, and in a protected environment, of course, so that they could test the accuracy of those things. And then, of course, our site might have had 30 people doing it, but then there was probably 10 other sites doing the same trial, and all that data was pooled together, and they can look at all that, and that's how they determine what goes in that package insert, so you can see that average variance and things like that. And of course, that is all submitted to the FDA before it's even allowed to be sold to us. So they had to have had a lot of data to support that. So I have a lot of confidence, although they aren't perfect. You know, there are obviously challenges, but that's ways you can get some of that data and how that actually works. It's very interesting.
Okay, next question. In our support group on Tuesday, we figured out that the user was closing her app, which causes the follower not to get the data. She
That's
laughed
true.
because she had no idea not to close the app and leave it running in the background.
That is true. And also sometimes if the user doesn't have the internet, we see this with children at school where they're out on the playground and there's no internet out there, and they might just be hooked to Bluetooth or to the Wi-Fi in the school. And so then the parent will lose the signal for a little while, and so there's things like that too to check out.
So then they lose all the data, Becky?
They don't lose it all, they can get it,
Oh.
but the follower won't see any data if the wearer is not, if it's not sending data to either through their data service on their device or their, on their phone or their Wi-Fi connection.
Got it. Okay. All right. Next question comes from Edith. That question, thank you, Denise, for submitting that question. Next question is from Edith. Have you used the Omnipod, and what is the difference between Omnipod Dash and Omnipod 5?
So Omnipod Dash and Omnipod 5 look the same. The pods look exactly the same. And the difference though is on Omnipod 5, your controller hooks up with your you enter your Dexcom G6 or G7 code in there from either your transmitter or your sensor. And then what it's doing is the pod communicates directly with the Dexcom for the 3 days it's working, and it adjusts your insulin. So if you're dropping, it can turn it down or off. And if you rise, it can increase insulin delivery. And it's adapting because it's keeping track of your daily insulin doses. And over time, it will adapt. And you can, of course, give a bolus using a controller or a smartphone if you have a compatible smartphone. But the nice thing about it, it's automated like those other systems are, except for tubeless. The Dash, again, it's used similarly, but it's not automated. So it doesn't hook up to your sensor and doesn't adjust for you. It just runs more as a traditional pump, giving a basal rate that you have programmed in there, and you bolus using that. I hope that answered your question in a nutshell.
Okay, the next question is from Christina, and it's it would be great to have the insulin pen locked so a person cannot double dose. She's been type 1 for 60 years, and she is just learning to read her graph now.
So they're giving extra insulin probably when that's not safe. And
yeah, that's what it sounds like, that it doesn't lock so that they could dial it up and inject it.
Yeah, that is an interesting situation. The insulin pumps, by the way, you can lock them, in many cases put a code so that somebody else has to access them. But yeah, that would be a nice thing for pens.
Yeah. So is there any other option for somebody who you're worried about dosing? I mean, doing that or double dosing?
Well, I kind of think of it as if they're making poor decisions, or, I guess as an adult, it's hard to say, well, you can't do your own insulin. But I think if their safety was of concern, I would probably have that pen put away and maybe
Mhm.
some kind of supervision. That's hard. I have some family members that kind of have been in that point where they're
Mhm.
adults and they're competent in some levels, but because their safety was at risk, we would kind of like we take a driver's license away sometimes if we are worried, that they're not safe driving or something like that.
Yeah, and another quick question too, don't they have the pen caps that used to monitor how much dose was given that they could look and see or no?
If
They're,
they use a smart pen, it will monitor it. Every time
okay,
they give
but
a
they
shot of one
still
of
can
those,
take a double
yeah,
dose. I
they
guess
could
that's
still
what you mean.
take it.
Okay,
Yeah.
got
So
it.
you can
Yeah.
see.
Yeah, I could see that that could be a concern. It's a great question. Yeah, okay. Next question comes from Deborah, and it's, do you do telemedicine consults for nutrition needs?
I do telemedicine through our clinic for our clinic patients that live. In Idaho, Southeast Idaho, we have a wide range of where people come from. It's kind of a rural area. And so I have patients live 3 hours away. And so I will do, if they're an established patient at our clinic, I'm able to do televisit. It's mainly because of licensure issues. And,
Right.
but yeah, I do telemedicine on nutrition as well.
But you can't cross state lines, right?
No, not unless I get a license in those
Okay.
areas. And because the patients are clinics here, to our clinic here in Idaho Falls, they're already patients. I can do telemedicine if they live in Wyoming or Montana or Utah, which is where a lot of ours come from.
Sure. Okey doke. So next question for me, so are both Omnipods tubeless?
Yes,
Both
yes.
tubeless.
And I wish I had one. If I can go back
Mhm.
and just quickly, I'll show you a picture of that. Let's see. Just have to use my technology. This is a technology presentation and I'm not as impressive on the Zoom as I know. Okay, let me just show you a picture of it here. Let's see. Let's see, find it here. So in this picture right here, you see this little pod right here. This pod is disposable. So it works for 3 days. You get them at the pharmacy and you fill them with insulin when you're ready to start them. They insert themselves, and then they just don't have any tubing. And so you would have a controller or smartphone to give a bolus when it's time to eat carbs or if you want to give a correction. But this is the 5, Omnipod 5, and it would be automated. So as long as it has a Dexcom working and your pod can see your Dexcom, it's doing its thing. It's pretty nice. Hope that answered your question.
Okay, and another question comes from Christina, and she says, not a question, but her mom is now in enhanced enhanced what do you call it, assisted living, I'm sorry,
Okay.
to have somebody else manage, and somebody else manages her insulin, but they're only reactive, not proactive, which is why I like the LibraLink with the alarms. I'm type 2 and my mom is type 1, so I get alarms for both of us. Wow. Yeah.
Wonder if you have a little bit of alarm fatigue, but that's nice that you're able to see, because I agree that's an area that we need to tackle as a healthcare system. Is as those of us get older that have had diabetes for a long time and are using these technologies, we want to be able to use them in those settings, and they're kind of afraid or hesitant to let people use them very much.
Right.
But that's good that you're able to get that. I think that's a good way to do it. So good luck with the alarm fatigue. I hope you're not, hope you're okay with that.
Yeah, and I still think like insulin management and like assisted livings and stuff is a little bit different than, and not quite as progressive in some
Yeah.
instances. So yeah, I guess having those alarms I think is really important too because of the risk of lows, right? So
Definitely.
okay, and somebody wants to know if you could show the app screen again.
Sure. Let's see, share. Find where it is. There it is right there. And there are more apps coming all the time. We just were trained on the Tempo app, and that's the one that's connected with the Tempo pen, and it had a feature where you could take a picture of your food and it
Wow.
would help you estimate carbs. We were trying it out and on some Thai food, and we felt like it was pretty pretty reasonable. So
Yeah. Yeah, I've heard a lot of that Happy Bob and a lot of the
Mhm.
My Sugar. I mean, there's so many apps out there. Yeah.
yeah, and there's more. Probably as we speak, there's probably one popping on the market now. So
Mhm.
so keep looking at it, and we're gonna keep updating the resources as we find good ones, and we'll be having some resources for that too for Diabetes Sisters.
Yes, and we'll always have the resources. They'll be listed on our website. And then remember, you could always join the meetups because our host leaders are pretty savvy and know where to kind of find the resources and know a lot of the answers as well. So if you haven't joined a meetup, it might be a good idea to kind of register for one. So we have another question, and it is, what is a bolus? I'm not on insulin, and it's
Okay.
my body. So
That's a kind of a funny word, isn't it? So a bolus, we usually define a bolus as a spurt of insulin that covers carbohydrate. So if your pancreas puts out a bigger spurt when you eat your meal, that might be considered a bolus delivery. But in when we're delivering insulin, especially with a pump, we have to give insulin for our carbohydrates and for correction. Sometimes if our blood sugar is too high, we can give a dose to help bring it down. You can do that with injections, with insulin pens, and with pumps and things like that. So the word bolus just refers to that spurt. And I think it's kind of an odd word. You don't hear it as much if you're not using insulin. And I had a 13-year-old patient that said, a bolus is a bonus because I get to eat something. That's how he remembers what it is. So
oh my goodness.
isn't that funny?
Interesting. Yeah. Good. Okay. The next question comes from Anonymous, and it's, if somebody is pre-diabetic, do you know how the new CGMs of Lingo and Stello differ from the other existing CGMs? Is it mainly the alarms?
Mainly the alarms, yes. And the functionality of you use a smartphone app with those, and the functionality is limited. But you can still see what your blood sugars are, but they're not designed to keep someone safe from a low blood sugar or anything like that. But they really are nice. We were a study site for Stello, and we have some people in our clinic that are using it, and I think it's really nice. You can see cause and effect, things, how does your blood sugar affected by different aspects, and it's a good learning tool.
Yeah.
And it's no prescription needed for those.
Very good. And then the last question we're going to take, it's there's a lot of barriers oftentimes for CGM and connected insulin systems, just dealing with everyday life. How do you help your patients overcome those challenges?
So when you're talking about barriers, I'm not sure if you're meaning, are they staying connected?
Probably just some of the everyday challenges. It's not specific. So
No,
yeah.
I think sensors are not perfect. I have my sensor. Sometimes it fails before it's supposed to. It loses connection occasionally, things like that. And so usually what we'll do is look at the placement of where the sensor is in relation to the pump. Different pumps have different sort of guidelines on what's better in that regard. For example, that Omnipod 5 that we just talked about and the Dexcom, the pod and the Dexcom need to be in line of sight. So they don't have to be right next to each other, but they have to be able to see each other. So if you had your sensor on the back of your arm and the Omnipod on the other opposite side of your body on your stomach, your body's kind of in between those two, and that communication doesn't work very good through water, and our bodies are basically big bags of water. We work on issues with just making sure things are staying on. And then we look at the data frequently so we can identify issues by looking at the data and trying to see how often is that happening. Also, if you're having those problems, you can call the tech support for the device that you're using, or devices if it's a pump and a sensor. And they often will they'll send you replacements. They will give you tips as well. And they're always trying to improve their technology, improving adhesives, things like that. So I find that a good resource.
Yeah, and I think too, for some of the challenges, just looking at kind of like our wonderful meetups and kind of like our host leaders and how connected they've been and helping people kind of like dealing with a lot of the barriers too. So, and the challenges and just everyday issues. And we really understand kind of like the value of peer support. And I just want to
Oh,
give
yeah.
a big shout out to our host leaders out there who are really helping our members with a lot of the different challenges and the resources. So all good.
I'll echo that recommendation to do a meetup, because we've developed some tools that go into the insulin pumps in more detail, as well as we have one
Right.
on when your when your technology goes bad. And things like
Exactly.
that. So,
Yes.
join meetups, and then you can have some really more robust conversations about this.
Absolutely. And I know Becky's put together a lot of information to really enhance our technology module, because now there's so much about technology out there. So a big shout out and thank you to Becky as well for really taking her time and really helping Diabetes Sisters. So just in closing, I just want to say a big thank you for all of you for your insightful questions, and of course for the wonderful presentation for Becky as well. So we're really out of time now. So what I'd like to just say is what's happening and what's coming up next at Diabetes Sisters. So on September 26th, we're going to be doing a lifestyle series, Mastering Diabetes, Nutrition, Weight Loss, and Wellness Stages, more of kind of a cultural aspect, and also around weight loss with Constance Brown-Briggs. She spoke with us before and she's coming back. We also are doing an expert series on exploring inhaled insulin, the benefits, usages, and beyond, with Diana Isaacs, who's a PharmD who does a lot of work with the inhaled insulin. And then on October 23rd, we're doing a women's workshop exploring inhaled insulin with Ginger Vieira. Ginger's an influencer and a woman with diabetes, and always shares her expertise and her willingness to help women through all different things. So she'll be joining us on October 23rd. And then on October 24th, we're doing a lifestyle series, Hearing Loss and Diabetes, with Joanne Rinker. Joanne Rinker is a dietitian, a certified diabetes care and education specialist, and has spent a lot of her time really working on hearing loss. So she'll be sharing a lot about that, and also the link with diabetes. So sign up today and join us for these valuable sessions. Today's program was recorded and it's available on demand. We also have the 2 resources. You could go to our website, go to resources, and then just put it in and download it from the resource section. And you'll also receive an email with a link to the recording when it's made available. So once again, a big thank you, Becky, for sharing your expertise, and thank you all for attending. And we hope you have an excellent rest of the day, and we hope to see you at our next webinars. Thanks, everyone. Bye-bye. Have a great day.